All right, let's talk about anti-mycobacterial or anti-tuberculosis medications. So indications for this from the therapeutic class itself, right? These are medications used for prophylaxis of tuberculosis as well as treatment of active tuberculosis. So it's used as prophylaxis in cases of potential or possible exposure to TB, and then again treatment for active TB. Side effects, so general side effects of these medications include hepatitis, liver toxicity, and nephrotoxicity. So liver toxicity, again, or hepatotoxicity, and nephrotoxicity is renal or kidney toxicity. In addition to that, INH, one of the medications, side effects include vitamin B6 deficiency or pyridoxine deficiency, or easier to say is vitamin B6 deficiency. So because of this deficiency, it can cause peripheral neuropathy, or basically pins and needles and some sort of nerve pains in the hands and feet. Some precautions include liver or renal disease. Contraindications include acute or major liver or renal disease. So nursing actions in general, if we are treating or using these medications to prevent or treat tuberculosis, these are the nursing actions or interventions that we have to do. One, we need to keep an eye on the diagnosis, right? We need to know, is the patient diagnosed with TB? How do we know that? Well, ideally, they should have done the acid-fast bacilli test or AFB test, as well as cultures and sensitivity. So by using this test, wherein they test the sputum, we can basically determine, or this will guide us in figuring out the appropriate combination of drugs used to treat the active infection or prevent the infection from happening from a potential exposure. In addition to that, we need to monitor and analyze our liver function test and hepatitis profile. In addition, it is also important to monitor and analyze our CBC or complete blood count, our BUN and creatinine, and as well as we need to make sure that the patients are taking the medication. So if there's any concerns for non-compliance or medications or the patients not taking their medications the way they're supposed to, then some patients need DOT or direct observation treatment. So this is where a nurse or a member or a staff of the public health department will go to a patient's house or maybe wherever they're staying, just to literally directly observe the patient taking the medication to ensure compliance. Again, this is very important because we don't want TB to spread in the community. When a patient is diagnosed with TB, there needs to be proper referral to the health department again, so this will allow them for monitoring and kind of giving them support and guidance while they're undergoing treatment. In addition, we need to consider family treatment, especially because, again, TB can be passed or communicated to other members of the family. And again, we don't want this to spread in the community. So at times it is necessary to test and treat the family members in that household. Examples of drugs under this class, so examples of drugs that treat tuberculosis or are considered anti-mycobacterial include the following. So we have INH or isoniazid, rifampin, rifapentine, rifabutin, pyrazinamide, myombutyl, and streptomycin. So let's start with INH or isoniazid. So INH is used as prophylaxis with exposure and as well as treatment of active TB. So again, this is both a prophylaxis and treatment. And with this medication, it is very important to have an order for vitamin B6 supplementation. Again, this is to prevent the neuropathy that can potentially happen due to vitamin B6 deficiency secondary to this medication. Next medication is rifampin. So rifampin, we need to make sure that this medication is taken on empty stomach, and we need to warn our patients that this specific medication can turn body fluids to red and orange. So this is very important because we don't want our patient to basically panic when they go maybe to the bathroom and they see that their urine is bright red or orange, right? So please keep that in mind. And also, in addition to TB, this medication can also be used with other infection depending on their culture and sensitivity results. Next medication is rifapentine. So rifapentine is used with other drugs to treat clinical TB. So again, this meaning that this is used in combination with other drugs. Just like rifampin, this can turn the body fluids into different colors such as red, orange, or brown discoloration. Next medication is rifabutin. So this prevents or delays TB in HIV patients. So this specifically given to patients who were diagnosed with HIV. Same as rifampin and rifapentine, this can cause discoloration of body fluid. So this should be part of patient education. Next medication is pyrazinamide, and we need to know that this is contraindicated in severe hepatic disease and acute gout. Another medication is myambutal or ethambutol. So please, just to remind you, please remember the generic names of these drugs. So myambutal or ethambutol, this is one of the first-line treatments for tuberculosis or TB. This is contraindicated in children less than 13 years old, and in addition, this is also used for other types of infection based on their culture and sensitivity results. So don't assume that just because they're on ethambutol that they have tuberculosis, because this can also have different uses. Next medication is streptomycin. This is not used as commonly as the other medications. Side effects. So that one of the main reasons why we don't often give this unless absolutely necessary is because side effects include ototoxicity, or basically it's toxic to the hearing, so it can cause ringing in the ears, and even it can cause deafness if we give this medication. And another side effect is nephrotoxicity. So again, nephrotoxicity it means that this is toxic to the kidneys and blood disc crashes, basically abnormal blood count. It can include your white blood cells, red blood cells, platelet, and so on. As you can see, there are some asterisks here. So the examples that you have to remember are the ones in asterisk. So INH or isoniazid, rifampin, pyrazinamide, and ethambutol.